Well, good afternoon. How is everyone? So a couple of things before we get started. I know the program says that Dr. Chris Saslow, Deputy Secretary of the VA, would have been joining us today. Unfortunately, he got called away there in DC, as that tends to happen from time to time, so he is not with us. Instead, we got another one of our wonderful partners from the VA, Communications Director Joseph Burks from the Caregiver Support Team, who we've done some things with in the past, and great partners, and appreciate the help, Joe, and the friendship and all the work that we have ahead of us to get done. So awesome. Now, as far as any specific questions go, I don't want to get too personal with your questions, if we can help that in this format. We do have booths set up in the exhibitors area. If you've been over there, you've seen that. Let's go with the one-on-one engagements for that, the more personal information, but anything general with the time that we have remaining when we're done with this, absolutely, we'll try to knock some questions out of the way. So I just want to be showing you a little bit about our DAV Caregivers program. It's still rather new, and we've got a lot of things that we're doing, a lot of things that we want to build upon and expand, because there's a lot of work to be done in this arena. And then Joe will be presenting some updates and providing remarks on the VA caregiver support programs. And also have some of our DAV caregiver support team down here in the front, Maria and Hannah, and they are there at that table in the exhibit area when they're not sitting in here, obviously. So please do stop by, encourage others to stop by and get as much information as you can. So with that, how many caregivers do we have in the room? Oh, good bit. How many enrolled in the program? Good. Good. So for all you others that raised your hand that did not raise it on that second question, go get enrolled. Please allow yourself to benefit from these tailored resources and things that are provided through the program. And one other question, how many caregivers do we have in here that don't know that they're caregivers? You don't have to answer that, but we're going to fix that, all right?
Yes, yes, and yes.
So what is a caregiver? Any ideas? You could be doing something as simple as medication management, running errands, providing meals, preparing meals, doing things for someone that can't do for themselves. And it's just a few small examples, and the list goes on and on and on. And you know, I run across a lot of folks that care for a loved one. And they say, well, I'm not a caregiver, I'm caring for my parent. Yes, we feel like that's part of our inherent duty to care for a parent, right? But we need you to be recognized, allow yourself to be recognized as a caregiver. It's important that we do that. It's important that we acknowledge you. And more importantly, it's really important that your stories be heard, told and heard, because you do a tremendous job. We call them the hidden heroes of our heroes, right? So again, I applaud you for everything that you're doing for those caregivers that we have in the room. And hopefully through our program, and as we continue to build upon this program, that we're able to provide you with some things that are beneficial to you. So right now, there are currently over 14.3 million military and veteran caregivers in the country. DAV, since the inception of our program in October 23, and then the formalization of our program in November 2024, we've assisted nearly 2,000 veteran families. We're proud of that, but guess what? It's a very small percentage when you compare that to 14.3 million. So we have a lot of work to do and a lot of people to reach, and we've got our work cut out for us. And another thing I don't want to be lost on us is the majority of caregivers are females, more than 60%, but let's not forget there's male caregivers out there as well. So we need to be aware of that when we provide programming, that we're balancing that on both sides. It's not geared towards female or males, but universally, what are we doing? And making sure it's a good fit for everyone involved. So what is DAV Caregiving? Our support program is evidence-based caregiver support platform that we use, powered by TCare. It's designed to prevent caregiver burnout, providing personalized support based on the caregiver's unique journey. And yes, every journey is unique. I think you'll realize that as you talk to other caregivers, that while there's some similarities, There's a lot of unique things that you go through that other people do not. So we try to make sure that we address that through the program. So through our program, every caregiver receives a customized plan. It's not one size fits all. The caregiver, and it's based on the challenges that they face in their day-to-day activities. This could be making calls, finding help, associating you or directing you towards medical equipment that you may need, financial resources, financial planning, mental health resources, and counseling services, and it goes on and on. And what's the one thing that caregivers do not have? Time. That's what I hear a lot of. There's not enough time in a day. So allow this program to support you in your day-to-day activities, and you don't know what you're missing until you realize what you've been missing. And I think you'll learn that through this program. Further, and as you go through your caregiving journey, things change, right? So you continue to receive reassessments along that journey also as things change and increase in the severity of a condition or things in life around the house, because you're not just caring for your care recipient, you're taking care of a home and oftentimes kids and maybe parents all at the same time. So please get into the program, and we're going to go through how you do that here in a moment. And the program really offers a confidential, judgment-free, culturally informed support to caregivers of all types: spouses, adult children, family members, friends, you name it. DAV in our program, I want to clear up a couple of misconceptions here, is for caregivers of veterans, their families, and their survivors. Sound like our mission statement, right? That's the way it will be. It's the way it will remain. We're not going to leave anyone behind. We will care for the caregiver in the grieving process should a veteran decease. We're going to care for them thereafter. If it's not a spouse, and through that grieving process, they would eventually fall off the rolls. But we're also caring for the children as well. Now, we don't have a lot of that programming that's formally in place yet, but we are working on that as we speak, because we can't leave the children behind. These children are on that caregiving journey as well. And we need to make sure that we do not and cannot leave them behind as we implement these changes. And I hope that's online. We're here in about a year, within the year, to be able to start delivering some of that. Because the children don't have the same childhood. You can't compare them to their schoolmates or classmates in the journey that they're on versus someone that doesn't know anything about having that military parent. When a mother or a father, or sometimes both, enlist or commission, they sign up too, right? And then when that parent or parents deploy, they deal with that absence. And then when they come home, they deal with the aftermath and the trauma. I wouldn't suggest that's a normal childhood. Would you? So what can we do? We're gonna do our part to ensure that the children are cared for just like the caregivers. And we're also going to take care of veterans who may be caring for a loved one in this program. Do you have to be a DAV member to utilize this program? You do not. We get calls all the time, says, yeah, I heard I had to be a member and I'm not a member. Well, scratch that. Are you a veteran, a family member or survivor or a child of a veteran? Get signed up in the program. It's that easy. That's who we're caring for. Do you have to be enrolled in VHA, Veterans Health Administration? You do not. Do you have to be in receipt of veterans health care? You do not. Do you have to be entitled to VA disability compensation? You do not. Very simple, very clear. This program is here to provide a service. Please take advantage of it. And I also encourage you, while you sign up for our program, that you also go get enrolled in the VA program, whether it's the general program or the comprehensive. We can run simultaneous and parallel to any VA programming. Take advantage of all of it. We see a lot of people that they tend to flock towards a monetary benefit. And then when they find out that they may not be entitled to the monetary benefit, they sprint to distance themselves from it. Guess what you're leaving on the table when you do that? And this program can help you in so many different ways that a lot of times that will equate to a financial savings based on what our DAV caregiver support specialists are able to do for you in your caregiving journey. So with that, what I want to do is show you what this screening process looks like. What we ask of you in the caregivers approach, or as you register in this program, give us 10 to 15 minutes of your sweat equity. That's all we ask for. Once you do that, the caregiver support specialist will take over from there and do everything for you. They're going to connect you with those local resources and benefits. They're going to do some of the transactional work for you. I went through the screening process. I tried to break their system just so I knew what you would be going through as I asked you to engage in this. And it got to the point they said, we'll fill out the paperwork for you and send it to you just for your signature, and then we'll send it on to the insurance company, or they'll connect you to the DAV NSO offices if you need help there. It comes full circle with all of our DAV programs and services. They'll connect you with voluntary services and volunteers in your local area to help come out and do things that you can no longer do for yourself, or to assist that caregiver to give them a little more free time. And I want to tell you a little story before I go any further to help drive this point home about the importance of caring for our caregivers and helping them avoid or keeping them from that point of burnout, that emotional, physical, and mental exhaustion. Because once we lose them to that, guess what happens? It's bad for your health as a caregiver. It could be bad for your family environment. It puts a strain on your family, your children, your community. So we want you to stay in a good place. So the story I want to tell you is at a conference not long ago I attended. There was a panel of 3 folks that presented, and then when they were done, they asked the panelists each independently, what would you do with an hour of respite? Typical answer was Mexican meal on the patio, margarita, take a deep breath, and not have to worry about anything, and enjoy that free time. Just to breathe deeply and enjoy it. Second panelist, very similar. Third one, they asked that same question to, and you know what her answer was? What would you do with an hour of respite? She said she would go and get a colonoscopy. Sounds funny.
Yeah.
Kind of is, but it made me wonder, and in a couple of seconds of her saying that, it dawned on me immediately how important it is to help these caregivers, to provide for them, to give them that little bit of respite when and where able, to allow them to go care for themselves. She didn't have enough time in her day-to-day activities to go do something like that. And she's begging for the opportunity to have that hour to herself. That's what this can do for you. So again, I tell you that story because I wanted to help drive the point home about the importance of this. We agree? I hope. Good. So 15 minutes of sweat equity, what does that look like? Not that. So if you go to davcaregivers.org, it's going to take you to this landing page here. And there's a little video. We're not going to play that. But you can listen to that video. It's some of the same things I'm telling you now about how simple it is to get enrolled in the program. You can see this Get Started tab here. It'll take you to the screen where you create your account. Enter your name, your email address, password. Then you get your password and you go and sign in. And then it takes you to this button where it says take the screener. And this is where we start answering the customized questions. And these are stacked on top of each other. And I'm not going through each one of these. I just want you to have an idea of what you're going to deal with when you take that screener and what getting registered in this program looks like. And again, more questions. And what these questions are, it's allowing our specialists to gauge where you're at in your caregiving journey. It's helping them start tailoring that customized plan for you so when you do connect, you're going to have a head start. They're going to have a head start on how to best assist you in your journey. Here, it'll give you your burden scores. Are you at high risk? Are you at medium risk, low risk? Again, placing you where you're at in your journey. And once you submit your answers, you can't go back and change those. Is that correct? Good. It's so small I can't read it. But again, as you can see here in this example, these scores and the ranges throughout the questions that you take in that screening process. And then when you get done with that, you connect with a specialist. As you can see, there's a calendar here. You will be connected with a specialist inside of 24 hours. If you know that you're not available during that time frame, you select your own date. You can even see the time slots over here that you want to have your meeting with them. They're going to call you. They're going to connect. They're going to ask you all these questions. They're going to start assisting you based on that screener that you took. And again, your sweat equity is already done. Now the work's on them. You just have to stay engaged, and you'll start that bidirectional engagement, staying connected, having that friendly voice, somebody that knows your story. And when I say know your story, it's important to note that when you get assigned to a caregiver, or to a caregiver support specialist, you're going to only deal with that one person, barring any catastrophic incidents or any major issues. And that's nice, because how many people have ever called someone and said, well, what's your story, and da-da-da, and then you transfer you to another one, number, and then they say, what's your story, and you got to tell it again? Have you gone through that? Not here. You're going to tell your story one time, and you're going to start that relationship, and you're going to start working with them, and they're going to start working with you on local resources in your communities. And I'm telling you, it sounds too simple and easy to do on your own. They're going to find resources that you never knew existed in your own hometown. All right? And it's going to be based on your actual needs. Very, very, very helpful. And also, once you finish that screener, you have opportunities to access educational links and various caregiver resources that you can see here. And you can search by your local zip code to see what else may be available in your local community. What's available in your community might be different than what's available in yours. I don't know. The outcomes will not always be the same, but they will go out of their way to ensure that that happens. We had a young lady in Dallas who's a caregiver and a mother caring for the disabled veteran and dealing with her children. And at every turn in this person's life, it's another brick wall. And she has been using that caregiver resource and the caregiver support specialist to help identify what those options are, what those resources are in her community. I mean, and I'm talking about anything and everything, folks. They had a tree fall in their house, put a hole in the roof, and they have a leak in the bedroom where the veteran resides. He's wheelchair bound. So the caregiver support team, they started finding resources of builders in the area that like veterans. They want to do things for veterans, and trying to find that at no cost for them. Does it always happen that way? No, but they're going to do that kind of work. Hopefully I'm painting a good enough picture for you on what happens through this program. And you can change your appointment times if you need to. Facebook peer support. We just started that page here recently, and it's designed specifically for caregivers. We want them to have that peer support network, that community where they can gather, tell their stories, understand that there's others dealing with some of the same things that they are. Encourage you, if you are a caregiver, to go to this Facebook page, get engaged. We try to provide some fresh updates and content. Time to time, we'll ask some questions, and then as we continue to grow this, there will be some professionally led sessions, and then there will be some peer-to-peer led things as well. But there's a lot of caregivers out there, and I don't have the actual page up here. I think it's about 120 folks that are in there now, and it just continues growing. There's a couple of questions, like a little vetting process to allow us the opportunity to make sure that we're hopefully dealing with caregivers here. And again, it's a great place for them to build that self-sustaining ecosystem of support. And then we'll continue to build that and build it out. Spread the word. This is our brochure. We have some on the table in the exhibitors area. I also have this in digital format. People ask all the time, how can I help? Well, we need member leaders to go out in the local communities and share this information. You know who they are. Go to your community centers. Go to the agencies on aging in your community. Provide this to them. Let them know we have this program to help veterans, their families, and survivors. We need your help. Please, I can't ask enough, or I don't know how else to ask, but please, if you don't have this, I will provide it to you in a digital form. You can take some of the physical copies, share it. You know, it's easy for us to go to Dallas-Fort Worth and evangelize this program. You know, there's a lot of resources there, but when you get into the rural areas, it's not quite as easy. You know, we got greater needs and less resources, food insecurity. There's all kinds of things that we need to do better at or be better at. What's a way to do that? Help us evangelize this program. Help us get that word out there that this exists. We'll do the rest of the work for them. Here's some QR codes, the DAV Caregiver Support, that will take you to the davcaregivers.org if you want to take a picture of that, and then the DAV Caregivers Facebook group. I'll leave that up there for a little bit. So what are some of the other things we're doing? This program will be much more than just what we're talking about here. We're looking at doing some family camps, some regionalized respite activities. It's a large undertaking. At some point, we will be doing a caregiver support national convening, similar to a national convention. I promise it will not be in Vegas. And what does that look like? We're building that out, but these are things that will happen. Family camps. We want to encourage caregivers to do more with their care recipient as opposed to for their recipient. All right? I understand there's a sense of dependence there, and sometimes that's just a necessary part of the program or part of the caregiving journey. But when we can foster that type of atmosphere and allow you to do things with, as opposed to always for, we want to do some regionalized respite activities in different areas. We understand the economic impact suffered by caregivers is tremendous. Some of them gave up careers, corporate careers, to become full-time caregivers. It's very difficult for them to maintain that sense of normalcy while they're suffering economically, but yet giving so much love and compassion to their care recipients. What can we do to help? Let's meet them where they're at. That's why we want to do some regionalized activities and get out in their communities where they're at and providing that programming there. So we'll be providing more information about some of these programs as we continue to expand. And the footprint, I'm excited about it. We're excited about it. It's not my program, y'all. It's our program. It takes all of us. They just asked me to get up here and talk to you about it. But it takes all of us to make it work. All right? We got our partners at the VA. I'm on the phone with them constantly. And I know it's separate programs, but working together, we can accomplish a lot more. So I just want to thank you for that. Again, for anything specific, and we'll be sending updates to all the member leaders, everybody that's in our database. We'll make sure that you're aware and updated on all the changes that are coming and taking place. We have a lot to look forward to. Feel free to share your ideas. It's not a one-person show by any means, so we appreciate anything that you can do, and feel free to reach out to us if there's anything else that we might be able to do to help you directly, or if you have a neighbor, somebody at your church, somebody at your kid's school that we can possibly assist. We want to be able to do that. And we'll hold off on any questions until Joe is done with his portion, if you don't mind. And at this time, I'd like to ask Joe to come on up. Come on, disconnect this.
Yeah. Sounds good. Thanks, man. Got it. All right. Before I even get started, I had taken some notes here, and I heard the word community 6 separate times. Can you not hear me? All right, I'm sorry. All right, let me start that over. I took some notes. Ron had said the word community 6 separate times. I want you to listen closely during my remarks for that same word. And then partnership. He started off with partnership. Partnership, folks, you can talk about it. You can write about it. You can put it in memorandum of agreements, understandings. But what you need for a partnership is actually get in there and do it. And we've done that. On behalf of Veterans Affairs, we have done that. We have partnered with Ron, your DAV Caregiver Support Program, and we've been at the same places with the same vision and the same outcomes, and that's building that community. So Ron, thanks for sharing that information. And with that, On behalf of the Department of Veterans Affairs and Dr. Colleen Richardson, she's the Executive Director of VA's Caregiver Support Program, thanks for having us here today. Thank you to the DAV and its auxiliary for continuing to elevate the voices and the needs of the nation's veterans and their caregivers. Always an honor to be in the same room with those who have served, but also to continue to serve and be there and show up for others. As the Director of Communications for VA's Caregiver Support Program, I have the privilege and honor of witnessing thousands of clinicians, staff, and caregivers across this great nation who are united by one goal. That one goal, delivering high-quality, veteran-centered care that honors the unique experience of those who have worn the uniform. Those who have worn the uniform. Hold that thought for just a little bit, because today I want to talk specifically about caregivers. Those who serve behind the scenes, consistently thinking about and putting others in front of all others. The truth is, and I say this loudly, caregivers are the backbone of the healthcare system. Caregivers are the first to notice a change in condition. Caregivers are the ones coordinating appointments. Caregivers are managing medications, and caregivers are often staying up late at night watching for signs of infection. So caregivers, I can't say it loud enough, you're every bit of the healthcare system. But most importantly, most of all, your family. That means a lot to each and every one of us. You are family. Whether bound by blood or by special bond, caregivers carry the weight of someone else's wellness solely on their shoulders. This kind of love and sacrifice may not show up in a medical chart, but it's real and it's powerful. It comes from people who give everything to care for their families. And at VA, we see that commitment every day, and we're working around the clock to honor it and support those who live it. We have two components to our program: the program of comprehensive assistance for family caregivers, along with the program of general caregiver support services, have grown in both scope and impact over the past few years. We've added mental health counseling. We've added services. We've included more and more veterans. And I go back just the normal 2 or 3 years ago, about 45,000 or so caregivers were participating in the program. Today, we are just under 100,000 caregivers participating in our program. Ours is legislation. Ours has criteria, a little bit more, difficult to get into the program, but only difficult because you have to meet the criteria which it was intended for by law. Whenever he's talking about DAV caregiver support, you don't have to go through all of that. You don't have to have those criteria met. But for us, under legislation and law, that's how you get into the program. But if not today, sometimes I say when. Maybe your health isn't there today where you would be eligible for the caregiver support program at VA, but maybe someday. I don't hope that on anybody, but I also say not a person in this room is Benjamin Button. We are not getting younger as we get older, all right? So just keep that in mind. So we've also respite care, mental health counseling. It was a few years back, mental health counseling, and we do it very well for veterans in VA hospitals. We were looking for that for specifically our caregivers who need that behavioral health, that mental health support through their journey. So when we looked inside the walls of VA, it just wasn't available. Whether space, personnel, employees, whatever. So we took it at Caregiver Support and we said, we'll own this. And we created this. It's a virtual psychotherapy program for caregivers, and it has grown like crazy throughout the nation. So if you want to know more about that, we can share it. Our table is out there in the exhibit hall, so come by, see us. Mike Z is my outreach coordinator. He'll be there as well. So again, those questions, we can answer those for you. But training, self-care courses to help with stress, burnout, and essentials of healthy living. All these tools that I'm talking about are crucial in supporting our caregivers' journey and sustaining this work over time. We're also focused on trust. I'll say that again, trust. That means better outreach, clearer communication, and making sure our teams in the field are trained. Trained not just to respond, but to listen. You see, caregivers aren't asking for special treatment. They're simply asking for partnership and community. They want to know that someone's got their back, just as they've had the back of their veteran all these years. One of the most powerful things I've seen in my work is what happens when we stop asking caregivers to go at this alone, and we together collectively start building care plans that reflect the reality of their lives. Because when we care for the caregiver, I promise this, we strengthen the entire system. Ron, I want to thank DAV. I want to thank you personally for being a steadfast partner in this work. Your advocacy has helped shape policy, improve access, and amplify the stories that too often go unheard. You've been in this fight for a long time, folks. I look around this room, you've been in the fight for a long time, and your voice continues to move the needle. I also want to acknowledge the caregivers in this room and beyond the room. This kind of takes me to, we go to baseball games, right? We do that. We go to basketball games, football games, large events. How many times do we hear, if you're a veteran and you have served for the United States Army, please stand up? Okay? That should never stop. You've earned it. Our country owes you that. But what I want to see moving forward is caregivers being in that same conversation. Because very rarely will there be a veteran that served this country without a spouse, a family member, child, and after they're back with injuries from war, a caregiver. So I want to acknowledge the caregivers in this room. If you're a caregiver, and I saw a lot of hands go up, or if you even think you might be a caregiver, you stand up. Please. And stay up. Stay up. Stay up for me. Stay up for me. Whether you've been in this role for a few weeks or a few decades, or you just started in this role, okay? Please know you are seen, you are heard, you are known, and you matter, caregivers. And the Department of Veterans Affairs, we are committed to walking this path with you. Thank you, each and every one of you. Thank you. You can sit down. And as we look ahead, I believe we have a responsibility to ensure that caregiver needs are not just an add-on, an a la carte. Your needs are a central part of how we need to design and deliver care to our veterans. I'm grateful to be here. Thank you again for having me here. But more importantly, I'm grateful for the work each of you do every day, and I personally look forward to continuing this journey with you. Thank you.
Thanks. And if they ask questions, we can answer from these. Thank you, Joe.
Yep.
And before we move on to questions, is Megan here from Cornerstone Caregiving? Nope. They have a booth. Cornerstone Caregiving is one of our newest corporate partners in the caregiving support program, and I just wanted to thank them that when we have a company that not only supports us and partners with us, but believes in our mission and supports the program, talk about a force multiplier. So if you happen to go by Cornerstone Caregiving in the exhibit area, thank them for what they're doing, and we're going to do a lot of great things. They have 270 offices across the country, headquartered out of Waco, Texas, which is very fortunate for me, because I get to go home and have a visit with them and see other people at the same time. But that's selfish, but that's just where they're located. But please do thank them for that partnership and really supporting, and not just supporting, once again, believing in our mission. Folks, our business sells itself, and it's always encouraging when you don't have to go really ask for stuff, when people just come to you. And Eddie and some of you guys over here may disagree, but it makes their job a lot easier when they come to us because they know what we do and providing that direct service. So I applaud all of you for that. That's across all DAV business lines. I don't think anybody in the business is better at doing that. I've been to a lot of places where they throw money at it, but they're not providing that direct service. And if they do, they're nowhere near as good as DAV is at doing so. That's from our NSOs, that's from our volunteers, that's from our caregiver support, that's employment department, you name it. DAV is the best. maybe it's my biased opinion, but it should be everybody's opinion in this room too. But I thank all of you for what you do to help carry that mission forward. So with that, if there's any questions, again, I'd ask that we keep those general to the extent possible. And if you have personal questions about a particular case, let's deal with those at our table. Yes, ma'am. We just need to know that it's a veteran, or it's a we just need to know that the care recipient's a veteran, or a veteran providing care to a loved one. And when you connect with the caregiver support specialist, there's a couple of questions there that, and we're not doing FBI investigations on this. I mean, hope nobody's going to call and tell you they're a veteran, and we have ways of knowing, but we don't deal with that much. No, they are there to support your needs as a caregiver. And I didn't talk much about this. There's caregivers that give less than 5 hours a week. Some are 40 hours a week, some are 20 hours a month. There's no perfect picture of what a caregiver is. I mean, everybody's journey, I did say everyone's journey is different, but it's tailored resource plans based on your needs as a caregiver. What is your situation? Does VA allow that to happen? Well, our support specialists are going to connect you with VA resources, community resources. There's, I forget the actual term, the daycare opportunity or
adult daycare.
Adult daycare.
Which falls under geriatrics and extended care, not specifically caregiver support. But
use your mic.
Is this on?
Hold your button down. Hold the button down on the bottom.
Test.
Well, that would work.
Got some loose wires. Can you hear me? All right. Yeah. Geriatrics extended care. So if you're in that situation, get with VA and work through that process. It's not necessarily specific to caregiver support program, but adult daycare, hospice care, those are available for those enrolled in VA care.
And again, the specialist, if it's not available in the community, and because I said earlier, you do not have to be enrolled in VHA, you don't even have to be drawing disability benefits. You can come into DAV's caregiver support program, regardless. Now, that may impact a caregiver support specialist's ability to refer you to the VA because you're not enrolled or you don't have any health care eligibility. So it wouldn't necessarily work that way. But they will find out, and if you are eligible, they will make that referral or that recommendation, or at least the connection between the two.
And I'll add, every VA in the country has a dedicated caregiver support team. We also have a caregiver support line phone number that you can call to start walking through that process. So feel free, your local VA, get in touch with them. They have exactly the information that you want. And our table will be out there. We're partnered right next to DAV's table in the exhibit hall. Stop out there. Brochures for you, nice cool giveaways. But more importantly, I think about this. Many caregivers aren't here today. Why? Because they're at home, taking care of their veteran who cannot take care of themselves. But I also guarantee this, nearly every one of you in this room know one of them. So don't think about outreach necessarily just for you today. You take this home with you and you give it to your neighbor, that veteran who can't get out of the house, okay? Thanks.
You mentioned that you had programs for children. Is there an age parameter or college age children, young adult children? Is there programs to train them or to help with their learning of how to be this caregiver
and I hope I did not misspeak, we are in the process of implementing children's programming. Currently, the VA does not deal with minors. You got to be, what, 18 and
18.
over. So we realize that there are many children in that caregiving journey, some in receipt of mental health counseling. We need to identify the service, and how do we deliver that to them?
So the college-age student wouldn't fit into the adult program portion of this. They could sign up for that if they're 18 and older.
Sure, and we just have to be careful. I mean, sure, if you're 18 or older and caregiving for a veteran, we're going to provide that resource plan to you and work with you. It's the children, and every state is different in how you deal with children. No offense, California, but every time we think we've got it figured out, you get to California, it gets flipped upside down again, and it's like, man, but I get it. Every state is different, and so just beyond identifying what that service and what those programs are, is how do we deliver? And we have to be very careful and work through general counsel and everyone else on that to make sure we're not working outside the lines, if you will.
Julie, did that answer your question?
Yes, sir.
I'm glad you stated, no personal information will be discussed here because, as a caregiver, we all have a long journey and how we got thrust into that situation sometimes. And I'll say this, I became an Alzheimer's community educator through that process as well as making this impact. But that being said, learning a lot of things. How is this particular, the VA caregivers, is there any connection or coordination with the Elizabeth Dole Foundation?
Yes, sir. And matter of fact, it's now law. So yeah, there's a lot of work. I'm probably in 7 meetings a week with Elizabeth Dole. And what we're seeing is continuing to build. There will be a comms communication package coming out at some point soon, kind of delivering what that looks like. So answer, yes, and we're happy to do that. And I heard it earlier too, children. While DAV is working on getting children, and educating that portion of caregiver, we aren't allowed to, based on law. We can't do anything under 18, but Elizabeth Dole does. And they call it the hidden helpers. And they're invested in children's lives in a caregiving journey. So thank you, that's great.
What about other organizations such as the Alzheimer's Association? Because as you know, there are 65 million unpaid caregivers.
Yeah.
And that information, resources,
Yeah. So,
when I talk to people, they don't know that.
yeah, and you know what? I hear that, and it hurts. Because as communicators and directors of communication, you think you're getting the message out there when we all know we'll never be able to tell everybody. So how do we do that? Partnerships, just like this. I have a very close friend who lost her husband to Alzheimer's, dementia, and didn't know a lot about any of the programs until what we would say is kind of too late. But we didn't stop. Fast tracked that, got her into the program, took care of them through the grieving process at the end of life and things like that. I want everybody to know about this program, and that requires all of us to share this program. Like I said, take it to your neighbors, take it to your churches, because I guarantee if caregivers are going to get out of the house once a week, they're going to church. So help us, help you, and if you have a local VA there and you want to partner, get in touch with them. Because we have National Family Caregiver Month coming up in November. That's the perfect time to do this. Sit at a table with them. Make the community, like we said, be aware of everything that's available.
So how, through that process, what I do for the Alzheimer's Association is more or less through the education, working with organizations, churches, even medical centers. That being said, how can a local chapter partner up with VA caregivers and be able to maybe, in reference to deliver this information to them and get them connected?
Where are you from? What city?
I'm in Virginia. I live in Yorktown, Hampton, Virginia is where my local chapter.
Okay. Again, every VA medical center in the country has a caregiver support team. I have a caregiver support line or you can go straight onto the website and you can find the Hampton VA. But bottom line, I've got your city. If you'll come up here when we're done, let me get your name. I'll reach out to somebody, have them personally contact you, and figure out how that partnership starts, okay? You bet.
As far as the chapter goes, before you leave, I mentioned earlier, I have digital copy, I have hard copy. Get out in your local community. We need the member leaders, once again, to assist in this endeavor, to spread that word, to educate each community across the country that this exists. It's of no cost to you outside of the little bit of sweat equity we asked for.
And to, And our goal is to let everyone know about this program. Kind of matter of fact, every state has a veteran commission, yes? All 50 states have a veterans commission. Most of you are probably tied to that. My outreach coordinator, Mike, has briefed Caregiver 101, which is basically A to Z on our program. It's an overview of what we do, who we are, who we serve. He's briefed 46 out of the 50 states so far this year. So he's going to wrap that up. We're going to have that done in FY25. Guys, that's information being shared to every veteran commission, which should be a web to each and every one of you. So we're not going to stop until everybody knows about us or Mike quits. No, that ain't going to happen. Anyway, again, as a communicator, it hurts me that everybody doesn't know. But we're going to do our best to make sure we do everything we can to help them know. Okay? Thanks. Appreciate
So,
you.
and before this question, and I'll be done with you, unless you had something else, but you ask about how can we educate these folks. Well, I guarantee you, if you're enrolled in this program and you call the caregiver support specialist and you're in the Hamptons, they're going to tell you that that Alzheimer's center exists, to go there as a resource. And then our duty is to go and let the Alzheimer's unit know that our program exists. It's a lot of, again, I mean, you talk about that bi-directional engagement, and the education goes both ways. Yes, ma'am, I'm sorry. And we want to do our best to prevent you getting, or any caregiver getting to that point of burnout. Because once you get lost in that, it's hard to come back. So we'd much rather work on prevention on the front end.
Thank you, and it is, because if someone like me, you feel bad because you can't help them because of their own body and your own limbs.
Right.
So thank you.
Thank you for sharing.
Just want to make it clear about the initial call. Does the veteran have to call or the caregiver that's hopefully going to be the caregiver?
Are you asking if the caregiver has to make the call?
Who has to make the first call?
You have to engage in the process so they know you exist, so to speak. They're going to connect with you. They're going to email you, they're going to text you, they're going to call you to make sure that you're ready for your appointment.
I got you, so the veteran has to call.
No, the caregiver support specialist will connect with you. Once you submit your screener, then they'll connect with you and they'll send text. And actually, I was like, I wish they would quit bugging me when I went through this. It was that good. Yeah, you bet.
And like limit the line and like maybe get to the point like, hey, we got time for one more question. Otherwise, it's good.
Now, one caveat to that real quick. There is a phone number for those that don't have access to the computer or savvy with the web or internet. They can call. You would have to initiate that call to start the process, and you would get in touch with the caregiver support team. But otherwise, everything is done by the support specialist. Yes, ma'am.
I'm from the Department of Oklahoma, Chapter 39. My name is Lori Dean, and my question here has to do with, I'm not sure if you got a second parents who have had children with autism spectrum disorders. And I am living with my 26-year-old son who's got Asperger's, oppositional defiant disorder, and all that fun stuff. So I'm looking for the support for helping steer him for the right directions for self-sustaining whatever's available for him. No. He was diagnosed before
Yeah.
he became an adult.
So you're looking. Yeah. Yeah. Yeah.
What she's telling her, she can receive help and support through the DV Caregiver Support Program. This is a perfect example. It's not always the veteran receiving care, it's a veteran caring for a loved one. All the same applies.
Good afternoon. My name is Brianna Wheeler. I am in Chapter 16 in Central Florida. My question pertains to, I guess, both the VA Caregiver Support Program and DAVs. So I understand that both the DAV Caregiver Support Program and VAs are supposed to be working hand in hand. What if our caregiver support coordinators at our local VA medical centers are unaware or uneducated about DAV's program?
Great question. We've addressed the National Caregiver Support Line. It was several months ago, and through working with Joe and the caregiver support team, we're continuously reaching out to these facilities, trying to make them all aware. I mean, as Joe said, there's programs at every facility in the country, and it's hard. Well, it's not hard. It just takes time to get that word out and educate them on what that is.
Follow-up question to that. I'm a veteran service officer at the Orlando VA Medical Center. Is there anything that I can be doing on behalf of the VA to better, I guess, educate the caregiver support coordinators that we have within our medical facilities about the VA program besides just offering them brochures?
Yeah.
Yeah, get on the PA system and tell them about davcaregivers.org.
Yeah. But so I would encourage you to reach out to our team in Orlando. I was down there last November during National Family Caregiver Month, a huge drive-through event. They care, they're compassionate about their jobs. Reach out to them, even if you need to come through me, that's fine. Again, I'll take your name or give you my digital business card, but let's connect that. And I'm telling you all, we have a prime opportunity this November to solidify these partnerships. So I encourage you all. They're going to be so mad at me next week. It's like, but call them, tell them, hey, I just listened to Joe at the DAV National Convention, and we would love to partner with you. And if any of them say, nah, not interested, call me, okay? And they're, yeah.
Thank you so much as well.
All right. And
Yeah,
I promise they're not going to say that, guys.
And let them get mad, because we have a lot of work to do, and if it takes people getting upset, then so be it.
Yep.
We got to press forward here.
Just want to say we've been monitoring your program since it started up, and many of us have joined it. Many of us are amazingly impressed, and we love to see the direction that it's going. So just want to give you a big vote.
Thank you.
We're monitoring the website for what the VA has been doing, what they have been adding on their podcasts and other things, and we're amazingly impressed on the tact and the way that they've been writing and putting together the websites. Thank you both for doing a phenomenal job. The caretaking over the last couple of years and the notice of it, the education of it has been fantastic. So California, thank you.
Oh, we appreciate you.
Thank you.
That's great.
I'm Kimberly Knowlton. I'm with the North Carolina State Auxiliary Past State Commander and current adjutant. We do a lot of like fall conferences where we bring our members in and try to teach them the things that we learn here. Is it possible to make available the PowerPoint so that we can provide that to them? Because that's a great resource.
Yeah, and we've talked about this, and that's been a recurring request. While that's just to give you an idea of what you're going to deal with as you engage the program, we're ever evolving, as we continue to say, and we're going to be building for years here in a lot of incremental changes. So I guess, what am I trying to tell you? If we did a PowerPoint today, next week it's going to be different, the following week, but we don't mind providing you with anything. We just want to make sure that you're dealing with the most updated material. And we're looking at a one-sheeter as well, because we can have somebody in good faith speaking about the program in Oklahoma, California, North Carolina, sending 3 different messages. There's a reason I said, no, you do not have to be a member. It's because somebody told in a discussion or presenting the program said you have to be a member. Not true. So we want to make sure we're very succinct in sending that same message. So we'll be sending that out to all the chapters, departments, and just trying to be consistent. Pardon me?
Can it be sent to the auxiliaries as well?
Oh, absolutely. And Bunny and I and Ann, we work together quite a bit and talk, and they're a big part of what we do. And we're going to speak to the auxiliary tomorrow just for a few minutes, because it's hard at convention with all the moving parts, district meetings, and auxiliary functions today to get everyone in the same room. So we're just going to go in there and say, hey, we have this program. Please engage. Thank you for what you're doing, and let them know about the exhibit area as well. You bet. You know, it's a shame that we have so many caregivers, and the general public and the hospitals in particular praise caregivers for what they're doing to give back, and the billions and billions and billions of dollars that it saves them. Well, damn it, it's time they do something. We all work together to do more than just thank them, but what are we doing in return for what those savings are? It's just, we got a lot of work to do. You hear it all the time, especially the for-profit healthcare systems, and that's in large part for your efforts as caregivers and the cost savings that they get to benefit from. So I thank you, but I think they could do better in helping us to support you as well. And that's part of what we're working on. That'll come through particular pieces of legislation and other things, working with Joy Elam and her staff, and Elizabeth Dole Foundation. I forget who asked that question. We are a partner with them on a few things, and the national convening. So again, we'll keep everyone updated and provide updates as they come available. Thank you all. Appreciate you.